Welcome to DCA TV. I am Jennifer Erickson, your host for today's show. Today we will speak with Dr. Christina T. Doe, a dentist at Smiles for OC, a comprehensive dentistry practice in Costa Mesa, California. Dr. Doe has been featured performing various dental procedures on the Emmy Award-winning show, The Doctors. She has received numerous accolades for her animated children's educational DVD called Tooth Tales. Her exceptional skills in laser dentistry have led to her being featured on PBS American Health Journal and laser dental educational videos. Welcome, Dr. Doe. It is an honor to be with you today. Today, we will talk about dental crowns and bridges. Question 1. What are dental crowns and bridges?
A dental crown is similar to a cap that covers the entirety of your tooth structure that when you smile, you would see inside the mouth. So a dental crown, I get this question a lot, does not replace your entire tooth. It just replaces the enamel, the part that you see when you look inside your mouth. So it's virtually a cap that covers the entire portion of the enamel part of your tooth. A bridge is also something similar, except it is not one tooth. It usually is a minimum of 3 teeth. So a bridge would cover 2 existing teeth inside your mouth and then have a fake tooth that would connect the 2 teeth on the sides. So usually it is a minimum of 3 teeth that make up a bridge.
When is a dental crown necessary?
A dental crown is usually necessary when we think about 75% of the tooth structure has been infected, broken, or traumatized. So the patient usually has 4 cusps to a molar and 1 to 2 cusps for a premolar. And so if a cusp gets broken, then usually you do want to crown that tooth because it's a heavy biting area. So if you put a composite, which is a white filling material, to replace that cusp, most of the time it will break. So a crown will give you a lot more function and a lot more strength to protect teeth that have gone, tooth structures that have gone missing or due to breakage or decay.
How long will a dental crown last?
So a dental crown will generally last, I would say, about a decade. And usually that decade would last because if you're brushing your teeth properly twice a day, flossing at least once a day, and visiting your hygienist twice a year, you can definitely get about a decade lifetime out of it. So now crowns usually have different lifetimes for different people depending on the quality of life of a person. So if a person is a heavy grinder, eats a lot of nuts, lots of heavy foods in terms of toffee, candies that are hard candies, then the crown may not last as long. But a patient who is willing to wear a night guard and has general wear and tear on teeth, then the crown can definitely last much longer than a decade.
What is the process for obtaining a dental bridge?
The process for obtaining a dental bridge is 2 steps. So when a patient loses a tooth, then they will use the 2 teeth adjacent to it as abutments. So those are basically the crowns that will hold the fake tooth to replace the missing tooth that the patient has lost. So at the very first visit, the patient will get a bridge preparation, meaning the 2 natural teeth inside the person's mouth will be prepared for the bridge. An impression will be taken, and then the impression will get sent to the lab, and then the patient will go home with a temporary bridge. That's appointment number 1. Appointment number 2, which is usually at least 2 weeks later, the patient will then get their permanent bridge. So in terms, a bridge preparation visit, or in order to get a bridge placed, it is a 2-part visit and probably about a 2-hour visit total time.
Well, thank you so much for your time, Dr. Doe. This concludes this episode of DCA TV.